Hello, my name is Fernando Lopez, and this is Frank Soto Leon, and we will be discussing the use of ocular ultrasound in the emergency department.
There are many indications for ocular ultrasound in the emergency department and include, but are not limited to, ocular trauma, pain, loss or decrease of vision, suspected foreign body, and suspected increased intracranial pressure.
There are no absolute contraindications to performing ocular ultrasound. However, caution should be used when evaluating a patient for a ruptured globe. Floating the ultrasound probe over the suspected eye on a layer of sterile ultrasound gel is recommended in order not to apply any pressure to the globe itself. Ocular ultrasound may be performed on a patient in the supine or upright position. Once a comfortable position is found for the patient, it is wise to do the same for yourself, whether it be in the standing or sitting position. We will now be demonstrating how to perform an ocular ultrasound exam. First, apply sterile gel to the closed eyelid of the eye of interest. Then, using a linear high-frequency transducer, place it on the patient's eye with the probe indicator pointing to the patient's right. Make sure that you anchor one of your fingers on the bridge of the nose or frontal region so as to not apply too much pressure to the globe. Most information can be obtained in the transverse orientation. However, rotating the probe clockwise 90 degrees will give you a sagittal view of the globe with additional information. This is especially helpful when evaluating an eye for foreign body. In the longitudinal position, artifact may be seen on the ultrasound secondary to air in the eyelid slit. The ultrasound image of the normal globe is circular and hypoechoic. It can be separated into the anterior and posterior chamber. On this transverse view of the anterior chamber, one can see the eyelid layers of skin, and immediately below this is the anterior chamber, which is made up of the cornea, iris, and pupil. The cornea appears as a thin, curved, hyperechoic line, while the iris appears as a structure that is hyperechoic and crescent in shape. The pupil appears as an anechoic half circle sitting in the lesser curvature of the iris. Although technically the lens is part of the posterior chamber, it is best visualized at a shallow depth and appears as a hyperechoic curved line which represents the posterior aspect of the lens. By having the patient look down while keeping the probe in the transverse orientation and fanning the probe footpad inferiorly, a coronal view of the iris and pupil can be obtained. In this view, the iris appears toroidal in shape, and the pupil appears as an anechoic circle. Increasing the depth of the ultrasound waves will help visualize the posterior chamber. In the posterior chamber, one can see the lens, vitreous humor, retina, and optic nerve sheath. The normal lens is anechoic, but the posterior surface appears as a hyperechoic curved line. The vitreous humor is anechoic, while the retina appears as a thick, homogeneous, hyperechoic surface. Further increasing the depth will assist in better visualization of the optic nerve and sheath. They appear as a hypoechoic tubular structure, which represents the optic nerve, flanked by two thick hyperechoic lines, which represent the optic nerve sheath. Measuring the optic nerve sheath may be helpful in evaluating a patient for increased intracranial pressure. This is done by measuring a distance of 3 millimeters from the posterior retina, and at that depth measuring the diameter of the optic nerve sheath. If this measurement is greater than 5 millimeters, it has been shown to be consistent with increased intracranial pressure. If any of the anatomy is in question, then ultrasounding the normal eye may assist in differentiating normal anatomy from abnormal anatomy. There are many pathologies that may be noted in the eye and include, but are not limited to, globe rupture, lens dislocation, retinal detachment, retinal hemorrhage, foreign body, and dilated optic nerve sheath. Let's look at a few examples. Globe rupture. This ultrasound image is from a patient that was assaulted. His eyelid was too swollen to try to open to see if the globe was ruptured. The ultrasound probe was placed on the patient's eyelid, and it was apparent that the globe was ruptured. Instead of seeing a nice, round, hypoechoic globe, we see an irregularly shaped globe with a heterogeneous echogenic center. Here we see another example of a ruptured globe. Lens dislocation. This ultrasound image is from a patient who sustained trauma to the eye from a water-powered rocket. A ruptured globe was suspected. When the probe was placed on the eyelid, what was seen was an intact globe, but not normal. The gain was increased and multiple abnormalities were noted, including a deformed iris, dislocated lens, and a small vitreous hemorrhage. Retinal detachment. This ultrasound image is from a patient who came in complaining of gradual vision loss over the last couple of days. Upon placing the ultrasound probe, we see a hyperechoic, wavy, thick line in the posterior aspect of the globe. This wavy line represents a retinal detachment. A maneuver to help clarify the diagnosis is to have the patient move their eye to the right or to the left, and the wavy line will move like a sheet in the wind, which is seen in this video. Bedside ocular ultrasound is useful within the emergency department, especially when it comes to the evaluation of a potential globe rupture, retinal detachment, or lens dislocation. Also, remember, there is no absolute contraindication to ocular ultrasound, but if globe rupture is suspected, minimal pressure should be applied in order not to worsen the situation.